According to the American Heart Association, nearly half of all people in the United States have some type of cardiovascular disease. The following portion of Live at 9 is sponsored by Stern Cardiovascular Center. And joining us now to talk about heart disease is their president, Dr. Steve Gubin. Thank you so much for joining us.
Thank you so much for having me. I appreciate it.
Okay, doctor, we are talking about the #1 cause of death in men and women in the United States. Talk to me about this.
You're right. Heart disease is the #1 cause of death in both men and women, and it's even a little bit more prevalent here in the Mid-South. And as a cardiologist who practices in the Mid-South, I want to change this statistic.
That's amazing that you're making a focus on this to let people know. Can you explain modifiable risk factors for heart disease?
Yeah, modifiable risk factors are risk factors that you can change. And the modifiable risk factors that we normally talk about are like smoking. If you smoke, you need to stop. High blood pressure, diabetes, high cholesterol, obesity, sedentary lifestyle. Stress is a big risk factor for heart disease, and also sleep apnea. These are risk factors that you can actually change and decrease your risk of heart disease.
And what are some early warning signs that we should look out for?
If you have chest discomfort, it's not always like what you hear about in the movies with like an elephant sitting on your chest, but if you have pressure in your chest, a heaviness, and this radiates to your shoulder, your neck, and usually it's brought on by emotional stress or activity. If you have these type of symptoms, you need to see the doctor. Also, if you get shorter breath with activity, that could be a warning sign. If you have a change in exercise capacity, it's another warning sign, and you need to see your doctor.
Okay, and are you talking about which side of the body? Is it the side where your heart is located that you're feeling this, or can it be anywhere?
It's usually on the left side, but it could be anywhere in the chest, and it can radiate to either side of the neck or to your arm.
Okay, so are there ways to detect this before you even see the symptoms?
Yeah, I'm very proud to talk about our vascular screening, which we started here. And the purpose of vascular screening is to prevent a cardiovascular event. That's the total purpose. And what we do once a month, after hours, you can come to our office, and we do vascular screening, which includes a screening of the arteries that supply blood to the brain. Also looks for abdominal aortic aneurysm. We check your blood pressure. We check your cholesterol. We also check a C-reactive protein, which is a marker of inflammation, which can be associated with atherosclerosis. And we also do a calcium score, which makes us a little different than some other screening programs. And a calcium score is when you go through a CT scanner, you don't get any contrast, and you don't have to have an IV, and it looks for calcified plaque in your coronary arteries. And the reason the vascular screening is so important is we can pick up patients who have disease before they have symptoms, and then we can help them prevent a cardiovascular event. Also, with the calcium score, a lot of times we have incidental findings. We may pick up a lung cancer or other things that can also be beneficial in keeping you healthy.
All right, Dr. Gubin, thank you so much for sharing this insight, and we were able to put your information on the screen so people can reach out. Appreciate you.
Thank you so much for having me.
And the preceding portion of Live at 9 is sponsored by Stern Cardiovascular.